Picture this. You're sitting in a sterile exam room wearing a paper gown that barely covers you, waiting for your doctor to arrive. When they finally do, they barely look up from their computer screen, and then they ask a few rapid fire questions, interrupt your answers, and within 10 minutes, you're walking out with a prescription and more questions than you came in with. Sound familiar? You're not alone. If you are new here and you've landed on this episode, welcome. I'm Dr. Bayo, your health advocate. I'm a practicing family medicine physician in Northern Nevada, and I bring what I see in my clinic into the work I do on the news, on social media, when I travel across the country speaking, and to this podcast. Today, we're talking about something that can completely transform your healthcare experience: how to build trust with your doctor and get the care you deserve in those precious 15 minutes you have at each appointment. Because here's what I want you to know. Your health is your most prized possession, and you deserve a healthcare relationship that honors that. Before we dive in, let me clarify something. Throughout this episode, I'll refer to your doctor or your clinician. I recognize many people have a primary care clinician that may be a physician, a nurse practitioner, or a physician assistant known as a PA. All of these specialties are trained, and when you hear me use doctor or clinician, I'm referring to any person who is overseeing your healthcare and can help you with referrals, prescriptions, or testing, which will help you get the answers you are seeking. Here's something I've learned from years of practicing medicine. The best healthcare happens when patients and clinicians work as a team. Think of it this way. You should be in the driver's seat of your health, with your doctor operating as your co-pilot. You know your body better than anyone, and your doctor knows the healthcare system and the body's biology. Together, you make a powerful team. But there's naturally a power dynamic when you see your doctor. Think about it. They have years of medical training that you don't have. They're the ones with access to your medical records. Plus, they're the gatekeeper to treatments, prescriptions, referrals, and possibly holding the answers to helping you feel better. You might find yourself sitting there in a vulnerable position, literally and figuratively. They hold all the cards. Maybe you're worried about being judged, or you don't want to seem difficult, or you're just intimidated by their expertise. The good news, you can level this playing field. Let me tell you about my patient, Maria. Maria came to see me after years of feeling dismissed by previous doctors. She'd been experiencing chronic fatigue, joint pain, and brain fog for over 2 years. One doctor told her it was just stress. Another suggested she lose some weight and exercise more. A third called her symptoms attention-seeking behavior. By the time Maria got to my office, she was defeated. She started our conversation by apologizing for taking up my time and seemed surprised when I asked her to tell me more about her symptoms and how they were affecting her daily life. What struck me about Maria's story wasn't just the medical mystery we needed to solve. It was how previous negative experiences had taught her to minimize her own symptoms and doubt her own body. She'd learned to be a good patient by being quiet and compliant, even when she wasn't getting the care she needed. Over time, we worked together to identify and treat her autoimmune condition. At one visit, Maria told me something that stuck with me. She said, "I wish I had known earlier that I could ask questions and advocate for myself. I thought being a good patient meant suffering in silence." This is exactly why today's topic is so important. Now, before we talk about building trust, we need to acknowledge that not all clinicians deserve your trust. There are clear warning signs that signal when a healthcare provider isn't the right fit for you. The biggest red flag? When a doctor dismisses your experience or tries to convince you that your symptoms aren't real. This is sometimes called gaslighting in healthcare, and your symptoms are always valid. You deserve to be believed. You should also be concerned if your doctor doesn't treat you with basic respect, uses name-calling, or focuses primarily on things like your weight or race instead of your actual symptoms. I've heard horror stories from patients about all of these scenarios playing out. Patients have even told me that their previous doctors called them lazy or crazy. This behavior is never acceptable. And here's something that should immediately raise concerns. If your doctor overshares about other patients, especially using names or identifiable information, that breaks patient privacy laws and shows poor judgment. On the flip side, let me tell you what good doctors do. They collaborate with you and make you feel like a partner in your care. They share their thinking with you, explaining what tests they're ordering and why. They make you feel safe and accepted as a human being, and they discuss all of your treatment options, including lifestyle approaches. Most importantly, good doctors start by creating a space that encourages questions about your health and the treatment plan they are recommending. Plus, they should encourage you to seek a second opinion if you don't feel their diagnosis, medication, or treatment plan is right for you. So, how do you build trust with the good doctors? It starts before you walk into that exam room. Come prepared. I mean, really prepared. Make a concise list of the top 2 or 3 concerns. Bring a list of your current medications and your key medical history. This can help you get the most out of your doctor's visit and have enough time to discuss your concerns. Let me tell you about my patient who we'll call Jimmy. Jimmy came in for his annual physical last month, and from the moment he sat down, I could tell he was different from many patients. He pulled out a simple note card with 3 items written on it. His main concern was his knee pain. Second concern was his blood pressure medication. And third, he just wanted to let me know that he had started working out more by walking around his neighborhood. During our visit, Jimmy also said something I love to hear patients say. He said, "Today, the most important thing for me is to talk about my knee pain. I'm really worried about it. I'm not sure if this is how I'm supposed to feel as I get older or if it's something more serious." That one sentence told me exactly where to focus our limited time together. If you're seeing a new clinician, practice a brief introduction, something like, "Hi, I'm Sarah, and I really value open, honest communication in my healthcare." This sounds small, but it sets a positive tone from the start, and you will stand out to your new doctor. During your visit, be honest with sharing your symptoms. Don't feel like you have to minimize how you're feeling and how those symptoms are affecting your life. For example, if you're experiencing chronic headaches, try and avoid saying something like, "I've been dealing with headaches." Instead, say, "I'm having headaches daily that are preventing me from driving, reading, and listening to music, which is something I usually do every morning when I get out of bed." The doctor needs accurate and specific information to help you. Now, let me share some phrases that can completely transform your healthcare conversations. These are what I call non-defensive communication strategies, and they help you advocate for yourself while keeping the conversation collaborative. When you don't understand or agree with a recommendation, try saying, "Can you walk me through your thinking?" This shows respect for their reasoning while getting you the information you need. Let me tell you about my patient who we'll call Rebecca. She came in concerned about a medication I had prescribed for her anxiety that wasn't working well. Instead of just saying, "This isn't working," or getting frustrated, she said, "Dr. Bayo, can you help me understand why you recommended this particular medication? I'm having some side effects and I'm wondering if there might be other options." I love when patients come in and say things like this because it opens up the opportunity for a real conversation, for me to know what's happening with my patient and for my patient to share with me that the medication I prescribed isn't working. If your doctor uses medical jargon or gives vague explanations, ask, "What does that mean for me practically?" Don't be embarrassed and don't feel like you can't ask them to repeat what their treatment plan is if you don't understand it. Also, here's one of my favorite questions. What would you want your own family member to know in this situation? This question humanizes the conversation and often gets you more personalized, empathetic advice. When you want to express your viewpoint without being confrontational, say, "Can I share how I'm seeing this?" This phrasing allows you to share your perspectives, including your fears or your lived experience. And it's a great way to have an effective conversation with differing viewpoints. I don't want to neglect an important topic. If you sense there's tension or miscommunication, try this. "Is there something I might be missing?" This is a great way to discuss any communication gaps there might be between you and your doctor. And if you don't feel confident in what your doctor has prescribed or recommended, let them know. That allows you and your doctor to come up with a new plan. Trust isn't built in a single visit, and it takes time to develop trust with your doctor. Here's one way to nurture a relationship. Once you feel comfortable and confident in your treatment plan, follow through on what you agree to do, whether that's filling a prescription, scheduling a test, or making a lifestyle change. Let me tell you about my patient who we'll call David. David has been managing diabetes with me for about 3 years. Now, what makes him stand out is how he follows through and communicates. When he comes in, he'll say things like, "That medication adjustment you made last time really helped. My morning numbers are much better now." The patients who do this really stand out because they show me that our partnership is working and that the changes we're making together are actually making a difference in their lives. Also, use your patient portal thoughtfully. Send brief, relevant messages when needed. But remember, everything you write becomes a part of your permanent medical record. Give specific feedback when something works well instead of just saying thanks. Try something like, "Thank you for really listening to me about my sleep issues. I feel heard." This helps doctors know what's working in your relationship. And here's something simple but powerful. Give positive feedback to the entire healthcare team. Compliment the front desk staff or nurses. Word gets back and it strengthens your relationship with everyone involved in your care. I love when patients come in and acknowledge the team effort. Just last week, a patient told me, "Your nurse was so helpful," when I called with questions about my test results. That kind of feedback makes everyone's day and creates a more positive environment for all of our patients. Sometimes, despite your best efforts, a healthcare relationship just isn't working. If you've tried these strategies and you're still experiencing those red flags we talked about, it may be time to find a new provider. Remember, you have the right to be treated with respect and dignity, to have your symptoms taken seriously, to ask questions, and to receive clear answers and to seek a second opinion. Your health is too important to settle for substandard care. Now, here's something important. You don't have to have a conversation with your doctor about moving on, but you can if you choose to. Not every patient is going to be the best match for every doctor, and vice versa. The most important thing is finding a doctor who listens to you, who honors your symptoms and concerns, and answers your questions effectively. If you decide to move on, you're going to want to request your medical records be sent from your current doctor to your new doctor. Offices may handle this differently, so ask them how they would like you to make that request and how your new doctor's office would like to receive your new records. Some doctors just prefer an electronic transfer. There are still some doctors who will allow you to actually bring in paper copies of your medical records. If you choose to have your records transferred electronically, I recommend calling in about a week or two to confirm that they received them. Just make sure that your new doctor has access to your medical history. Building trust with your doctor isn't about being the perfect patient. It's about being an engaged, informed partner in your healthcare. You are not powerless in these relationships. When you combine your knowledge of your own body with your doctor's medical expertise, amazing things can happen. The strategies we've talked about today, from preparation and communication techniques to recognizing red and green flags, these aren't just nice to have skills. They're essential tools for getting the healthcare you deserve. Your health is truly your most prized possession. Don't settle for anything less than a healthcare relationship that honors that truth. Did something in this episode stick with you? Share it with someone who might need these insights too, because real healthcare happens beyond clinical walls. When you show up as an informed, engaged patient, you don't just improve your own care, you model what's possible for everyone around you. And that's how we create the healthcare system we all deserve, one relationship at a time.